Hi, Dr. Emily Jiles. I'm at Dr. Jiles Cosmetic Surgery here in Sarasota, Florida. And continuing our discussions about breast implant complications, I wanted to present a little case to you. So grade 4 capsular contracture is when the body will form scar tissue around an implant, and it can become very firm, painful, and the breast can look very distorted. This is something that we can diagnose clinically just by looking at it and just by the patient reporting these symptoms, because unfortunately when it declares itself, it is very obvious. So this patient here, I'm just going to show you, presented to me with grade 4 capsular contracture with some old saline implants that had been placed several years before, at least 15 years prior. And in her case, this is her post-procedure result. At this time, you can see how large and just how they almost look like hard objects, and that's exactly what they felt like. They felt like stone, extremely uncomfortable to the patient. She wanted to get the implants out, do a breast lift, and then also do another softer, newer silicone gel implant from Mentor. So that's exactly what we did. These procedures do have to be staged because if we were to take out an entire capsule with an implant and then do a lift and then place another implant right away, we face a very high risk of having more complications afterwards, such as a seroma or fluid collection around the breast that can potentially lead to yet another capsular contracture. So we do have some ways to try to avoid the recurrence of the capsular contracture, but the risk is always going to be higher if you've had it before. So there's several tricks up our sleeve we can use. Singulair, which is an off-label use to try to prevent the recurrence, and then we can place the new implant in a different pocket. So that's exactly what we did here, and you can see the post result, completely natural, soft, much smaller, basically exactly what the patient wanted. And when I tell you these patients are happy afterwards, despite it being a 2-part procedure, I mean, they are elated to have a nice, soft, pretty, feminine breast again, without the big, hard implants with the capsular contracture. So that is my presentation for today. If you have capsular contracture, think about coming to see me or anyone else who's board certified and does breast revision surgery. And I would love to hear from you. Thank you.